Welcome to part 7 of our Educational Diagnosticians series. In this segment, we're really going to talk about the differences between different types of test scores that often come from our standardized assessments, our rating scales, different kinds of screening tests that we use. We tend to have so many different types of test scores that it's hard enough for us to sometimes understand them, but also very hard to explain the differences to other members of our team, our gen ed teachers, the parents, sometimes our administrators. So we need to have a good understanding of those ourselves so that as we explain them in our reports and at our meetings, that the differences are clear. So we're going to talk about those different types of test scores and things that we might want to consider as we report them in our written reports as well as reporting them out during the meetings. Test scores can generally be categorized in two different ways. Test scores that tend to be criterion referenced and test scores that tend to be norm referenced. So we're going to talk about each of these different sets of scores and how to explain those. So we're going to start with talking about raw scores. Raw score is simply the number of items or objectives that were correct. So you may have gotten 5 points, or you may have gotten a score because you answered 7 correct on something. Those types of scores are helpful to us as we calculate other kinds of scores and tell us a little bit about how the student did, but they can be very confusing if you include them in your reports because they generally have no meaning until we convert them into something else. So they can be confusing, misleading to parents and teachers. I would highly encourage you to consider not including these in reports just because, again, they have no meaning. To know that I got an 18 doesn't tell me whether I did well or below average. It doesn't tell me any of that. And it also doesn't tell me anything about proficiency. So it is important, again, we have to have those raw scores in order to calculate other scores, but they tend to be just clutter in a report and not helpful to the reader. Another type of criterion reference test score are cut scores. And we know about cut scores mainly because they have been used for years in our statewide testing. So we had cut scores when it came to the I-STEP, and we now have cut scores for iLearn. So for example, last year's 3rd grade iLearn test, the cut score for 3rd grade in English Language Arts was 5416, and that was the cut point to say you now can be considered approaching proficiency. 5460 told us that you had hit the point of being called at proficiency, and then 5515 indicated that you were above proficiency. Now, that is the bottom level, the bottom score in each of those categories to be recognized as within that category. So if you think about the way those scores are laid out, then anything between a 5416 and a 5459 is all the same category of approaching proficiency. So again, it just tells us in what category do you fall. And we tend to see a lot of cut scores used for screening type tests that say as long as you at least hit this number, we think you're doing okay. Or as long as you hit this number but haven't exceeded a different number, you're in a category that says we need to pay attention, we need to support in some way. They're general kinds of scores, but again, it's just giving us kind of that bottom level to be considered into a certain description or to be considered passing or at a level that indicates either concern or no concern. Another type of criterion reference test score would be a percentage, and percentage is simply that straight mathematical calculation of the amount or number of correct answers out of a particular number of questions or items. So for example, if you got a 7 out of 10 on something, we know 7 divided by 10 is 70%. And we all are very used to talking about percentages as they apply to a grade. Thinking about in some schools, 70% is considered a C or an average kind of score or grade. In others, the grading scale may be different, but we tend to correspond those percentages to what we think of as those A, B, C, D, F kinds of levels. Percentages sometimes get confused by the reader with when we use percentiles. So we need to make sure that we are very clear when we're using a percentage versus a percentile, and we explain that within our report so that they are not confused. We sometimes will use percentages to further describe some of our other test scores or performance on a particular subtest. For example, you may give a reading comprehension test and be able to tell how a student did overall, and maybe you'll have a standard score or a scaled score to reflect that. But within that, you may be able to describe further how a student did, that on the items that they completed that were inferential versus concrete or specific, you may be able to tell that the student got 70% of this type of question correct, but only 40% of this type of question correct. So it's just giving further description. You can use it in a lot of different ways, but again, just be very clear as you're explaining this within your report and as you're explaining it at the case conference. Now moving into norm reference test scores, one of our most common is to use standard scores. A lot of our test measures will provide us, especially our academic testing, academic achievement testing will provide a standard score. So what it does is take that raw score, so we have to start with the number that the student got correct, how many points they got, however this is measured, and then that is converted into a number that follows a normal distribution. So if you think about that good old bell curve that we've all learned about in past courses and in college classes, we know that a normal distribution follows a curve, with most people falling under that central larger region within the curve. And then we have fewer and fewer people that tend to get away from that average performance, either on the high end or on the low end. So using standard scores, it takes the student's performance and shows where they fall in relation to the average. So a typical average score is 100, and then 85 to 115 is considered to be within normal limits or within that broader average range. Now some of our tests will specifically categorize 90 to 110 to be the average range, the hardline average, but within 85 to 115, that is one standard deviation on either side of that mean of average, and that is still considered to be within normal limits, or within where most people are going to fall who are tested. So our standardized measures are standardized across a larger population. They use that same assessment with many students across the country, so that we can then take our student that we're working with on an individual level and compare them to a broader range of kids across the country or across the world, depending on the population that the instrument was standardized on. Scale score is similar. but a very different set of numbers. So a scaled score takes the raw score and then adjusts it and converts it to a standardized scale. The reason that we have scaled scores is so that we can then be able to look at an individual's performance across a very consistent scale. Now, scale scores can be different from test to test. So many of the tests that we tend to use will have scaled scores that fall within the average range when they're between about 8 and 12, but that's not always the case. So it is very critical that we understand what scaled scores represent the average range so that we can make those comparisons. I've sometimes seen other tests in other fields, such as in the area of language, where the scale score is different, and 8 to 12 is not necessarily falling within the average range. So you need to make sure and always consult the test manual so that as you're reporting, you can put those descriptions right into your report so that a parent can say, oh, my child got a 9 on this. Now I know what it means because a score between this and this falls within the average range. We have T-scores on a lot of our behavior ratings, and some of our cognitive assessments will also give us T-scores. These are very similar to standard scores as well. However, in this case, the average is 50, and the scores between 40 and 60 are considered to fall within the average range. So as we look at a T-score, if we have a 50 on a T-score, then a similar conversion would be 100 on a standard score. Now think about this from the framework of a parent or a teacher reading a report where you've just gone over some information and said, you got 100 on this, and that was great, that was within the average range, and suddenly we shift to a new test and you got a 50. My first jump as a parent would be a 50, oh my gosh, my student or my child is doing terrible on this assessment. So again, it is absolutely critical that we define those things and that we use those descriptors in our reports to make sure that there isn't a lack of clarity, there isn't confusion, and that we get right to that point of explaining what the outcome is, what the results of those evaluation instruments are telling us. Percentiles. Percentiles, again, can be confused with percentages, and I've heard them misinterpreted in meetings a number of times. So we have to be very careful with percentiles. What a percentile does is it shows how a student's performance on a particular assessment falls in relation to a group of other students as far as ranking. So picture that your student has taken this assessment in a group of 100 other kids. If you rank ordered how they did, where would this kiddo fall? So if I got a percentile, if I scored at the 5th percentile, that means that I would rank 5 out of this 100 group of kids, which means that 95 other kids did better than I did on this assessment. I would be number 5 starting from the bottom. So again, this gets very confusing, and especially when you think about the difference. If I score at the 50th percentile, I'm right in the middle, which means I did well. I scored within the average range because I did as well or better than 50 kids. But if I get a 50% on something, we generally think of that as being at a failing level. That means I missed half of the questions versus being within the average range. So very, very, very different. I personally choose not to report percentiles in my reports, if at all possible, unless I feel like that's the best descriptor for how a child did, because of that confusion factor. And I want to make sure that my reports leave as few questions as possible when it's complete, and doesn't lead somebody down the wrong path of thinking. So again, there's nothing in Article 7 that says what you can't or should put in a particular report, what kind of scores you need to use and what kind you don't. You may have specific guidance from your director or your local procedures. Your school attorneys may advise you to include certain things and not include others. This is my perspective, which is the less confusion the better, and because I find that they tend to lead to some confusion, I personally just don't like to report them. Confidence intervals, that's another sticky wicket for us to think about. Do you really want to have these in your reports or not? So we know that the day that we test a student, the day that we have them complete an assessment, the day we have somebody give us a rating scale, anything like that is one brief moment in time, which means I could take the test again tomorrow and score differently. So what a confidence interval does is it gives us a range of scores that my score is likely to fall most of the time. So we have confidence intervals that can be generated at different levels. The 90th, with 90% confidence, or with 95% confidence, or even some of our tests recommend that you look at an even broader or a tighter range of confidence, or 99% of the time. There can be a very big range of how you generate these confidence intervals. Now, some of our tests only give you certain options within their tables to actually generate these scores. Again, this is one that I choose not to report, but I know that it's there for us to maybe have some discussion around as the M team comes together to discuss findings, as the case conference comes together to make decisions, and sometimes also as our M team uses information to decide, is there further testing that needs to happen? We may look at confidence intervals there. I've also seen them very misused in the past. I've seen a student maybe test in the mid-70s on a cognitive assessment, but using a broader confidence interval that says, well, 65% of the time this student might score way down here or way up here, and had that low score used to justify a placement decision with having a mild intellectual disability. So I think that sometimes our scores, using the confidence interval, you can use that to make a case that's maybe not really justified. And having too many scores can really confuse parents and teachers. The more that we put in a report, I think it just adds clutter to the message that we're trying to explain in the report. Stanines are used still on some of our assessments. They're used on the COGAT that we sometimes have available to us when we're reviewing information for a student. But what it does is take all the percentile rankings, so again, not percentage, but percentile, and then it divides them into 9 different groups. And the groups are not equal, just as you think about that bell curve, right? If you chunk things into 9 different groups, the amount of students in that grouping, it's going to vary from group to group. The scores range from 1 to 9 and 5 is average. So again, you're going to have more falling in those middle numbers and fewer kids that would be in the 9th group and at the 1st group. So again, it's just giving us another way to look at where a student falls in comparison to other students. Z-scores are also a norm reference type of score, where 0 represents the average, and then scores go up to 4 and down to -4. So anything that falls in the positive range, so anything above 0 is above average, and anything below 0 is below average. I see very few actual tests that will give us a z-score, but they still are used in some of the other kinds of assessments that we have. The biggest caution that I can give you is in using age or grade equivalent scores, because they are very, very misleading. And we have a lot of assessments that will give us an age or a grade score, an equivalent score, on the test printout, and the understanding of these is not good. Just in general. It's hard to even explain to other people, so having them have a good understanding of what these mean is usually not there. So we think that, or we would naturally kind of think that if I get a grade equivalent score of 3.4, that it might mean that I'm at a 3rd grade 4th month level. And that is not what it means. It means that my score is the same as the average student in the same age or grade at that level. So it would, if I got a 3.4, then my score is the same as the average student in the 3rd grade at the 4th month. But that doesn't mean that I have skills that are necessarily at the 3rd grade 4th month level. So it can be very confusing. And again, I think it can be very misleading as well. I may have lots of splinter skills that have, some holes here and there in some of my foundational skills. I may have some advanced skills, and none of that really is reflected in an age equivalent score or a grade equivalent score. I would highly discourage you from using those in your reports because of the confusion that it tends to lead to. If you look at the different kinds of norm reference scores that we have, they can fall within kind of a comparable or a good comparison range where you can tell if I have a standard score, this is what it would correspond to for a t-score, or this is what it would correspond to for a percentile. So this chart just really reflects one way of looking at it. We have different kinds of qualifying terms that describe what a score means, and pretty much every test gives you something slightly different. So a lot of our IQ tests may use certain descriptors. You can see on the left and right hand sides of this chart that we may talk about average, mildly below, above average, or we may use terms like deficient. Some of our test scores will talk about low, very low. There are lots of different ways. Now, the problem is because we are using many different assessments, typically in a multidisciplinary evaluation, we're going to have different tests calling the same numbers different things. So I would encourage you to, within at least the M team or within your local district, come up with a scale that is uniform so that as as you're trying to explain these things in meetings and as you're trying to describe them in your reports, that you're sticking with the descriptive set that goes across your different assessments. So that if a 75 is considered below average, then a 75 is below average no matter what assessment that you're using. Otherwise, it gets to be very confusing. I mean, as a parent, I think I would really struggle with saying, wait a minute, my student got the same score on this assessment. Why did you call it something different? So what you come up with really is kind of arbitrary. It's just a matter of making sure that you're trying to stick with one of the common descriptive scales and applying that across different instruments. So again, this is one example. You may have your own example in-house, and that is fine, but just be consistent. So again, Article 7 really doesn't tell us a whole lot about what needs to be in a report, other than there are very specific things that have to be included for specific learning disability and for autism spectrum disorder. But when it comes to whether or not to include scores, what kind of scores, it doesn't tell us anything about that. So that has to be a local decision, or it may even be a decision, at the individual level within the multidisciplinary team. But I would encourage you to have that discussion at your district, at your co-op, and decide how can we be more uniform, because we do have a lot of kids that tend to bounce from school to school, and sometimes within your co-op area from district to district, and having something that no matter where the kid goes, the reports are similar. Not identical, but the reports are similar in a similar format is comforting to teachers to know, I know how to read this because I've read a report like this before. I know how the scores tend to be laid out. I know what this means. Strive for simplicity in your reports. Get to the point. Don't flower things up. Just really explain the results. Try to move to reports that clarify as much as possible. So really explaining those different types of scores and explaining those instructional implications of the results. And then utility is important. Why do we even have reports? Well, we use them to make decisions, we use them to share information, and we use them to think about things like eligibility, but also about instructional implications. What kind of supports might the student need? What kind of services might be appropriate? What kind of goals should we potentially be writing for the student? All of those things should jump right from our reports into the hands of the case conference committee who are potentially going to be writing an IEP. So I just want to show you, these are just a couple of not real assessment reports from any student. These came straight off of the test company's websites of some example reports. But you can see this is from the KTEA, so from an academic achievement test, and this is what the company's automatic scoring will give us. Now, if we were to copy paste this into a report, look how overwhelming this looks. There are so many different types of scores that as a parent who doesn't have the same background in assessment and in understanding test scores, this is visually way overwhelming. So really think about what are the important pieces here. Do you need to report certain scores or not? Do you want to have descriptors or not? Do you even want to report on very specific subtests? Some people don't. Sometimes it is all narrative, no chart. Again, there's no Article 7 guidance on this, so you need to think about your local in-house guidance. Here are a couple more examples. This is from the Woodcock-Johnson Test of Achievement. There are a lot of scores here that I can't tell you what they mean. W scores, age equivalent scores, RPI, we've got confidence interval, we've got standard scores. We've got a lot of stuff here that, again, if I'm a parent or a classroom teacher and I look at this chart, I'm probably done reading the report because it's just too much. There's some more from the Woodcock-Johnson. So just be very, very mindful about what you choose to report and what you don't. So think about what is meaningful to the team, what is meaningful to the parent and the teacher. What do they really need to know? Remove things that are unnecessary or confusing or definitely misleading. Again, those grade equivalent scores, age equivalent scores, I would suggest that you get those out of the reports. So some tips, again, keep things to a minimum. Include only the necessary things. Some of you include charts at the end of the report just so that it's all there for if another professional needs to see this information. But keeping the narrative together, again, that's preference. You can have them within the report. You can have them not in the report at all. You can have them all together at the end. And think about those issues around really keeping things clear and useful. Thank you for staying with us through this series. I hope this information is helpful. Continue to visit our other topics as well as the information on the Padlet. Thank you.